Wikidonist.com. Truth about tooth.
World is battling corona in a very serious manner. Every country, every nation, every state, every district, every person is actually combating coronavirus, and COVID times have become really tough for the people because it's not only affecting your daily lives, your relationship with people, your businesses, your health, and so many matters. So it is a difficult time, and most of the people, especially old people, are not venturing out of their homes. They are being confined to the rooms and confined to their spaces, and it is very tough for people to combat this COVID times. Now the problem is most of the people used to go to a dentist, have their dental checkup done. Most of the people who are elderly had to go to the dentist and get your dental checkup done, and all their problems used to be sorted out. Even smaller problems could be found out and things like that. Now there is no chance because most of the time they cannot go to the dentist, they cannot go to a place where they can have their dental checkup done and things like that. They are really scared to travel, especially by public transport, and go to a dentist and get the treatments done. So what can we do at this point of time? How can we efficiently actually delay the dental treatments, or efficiently delay the dental appointment at least, and give a better oral care during this COVID times? It's very important. And most of the people ask, doctor, can we delay this procedure? Can we delay that procedure? All those questions are there in the people's mind. So we are, as dentists, we are actually upscaled ourselves, and we have done some real good changes so that we can welcome the patients to the clinic. It is not that you should not go to a dentist. We can actually welcome you, but most of the people are scared. Most of the people are worried of traveling. It's not about the dental treatments they are worried about. They are more worried about the travel and getting out of their homes and getting other people involved in their lives, because it can actually transmit COVID and things like that. And COVID is something which people have not understood even now. Even the best of the doctors have not understood how it spreads and how it can communicate to people and how it affects different people, because it has affected young, and it has affected even 40 years old people have died. Even some of the elderly people have survived. So we don't know what's actually happening. There are some mutant varieties. There are some there is unknown things about COVID. So people are really scared about coming out of their homes and out of their places. Actually, we should not be scared, but the media has instilled a lot of fear. But it is good in somewhat in containing the virus, but it has actually depleted our health. It has depleted all our relationships. Thanks to social media, at least our relationships are much better. So today we will talk about the home care that has to be taken, especially what all has to be taken care, especially for COVID times, because COVID times has been tough. Now, the most important thing is you cannot go sunbathing in most of the cases, or we used to walk around, we used to go around in the open. Especially in Kerala, we have a lot of sun, and that was sufficient enough to give you enough vitamin D. Now, vitamin D is deficient in most of the cases. Most of the cases who is coming to dental clinic, they have problems with bone receding, their gums are receding because there is a lot of osteoporosis happening. That is actually because of the vitamin D and calcium deficiency, which is happening in rampant in most of the cases, especially after this COVID season. Even I had suffered a lot of vitamin D deficiency, although when I checked for my vitamin D, it was actually low. So I have started taking vitamin D supplements, because that's very important. So that is one thing which we have to look into, because the calcium metabolism changes if calcium, although we are taking some of this some calcium rich food like milk and things like that, still the calcium is not absorbed. If it is not absorbed, it is of no use taking it. So vitamin D is very vital for your dental health. So let me tell you, that is one of the main reasons why dental problems are increasing during this COVID times. So please make sure that you take a vitamin D. Even if you cannot go to a place where you can test, please take at least once a week, take a calcium vitamin D tablets, and if possible, go to your rooftop, have a little sun on your body. Please exercise a little bit in the sun during the evening or in the morning. So please do that, so that you will get, because that's very important. It's also that we should confine ourselves from the rest of the people. So please make sure that you can go and do some exercise and some amount of exposure to the sunlight before you. That's very important for your health. So that's one thing. Second thing is, if you are having caries in your mouth, already you are a dental patient, you have some fillings done in your mouth, that means that you have a caries prone mouth. So if it is a caries prone mouth, please make sure that you use a fluoridated toothpaste. Why a fluoridated toothpaste is, fluorides helps the enamel to combat bacteria by making a calcium fluoride layer on the tooth, so that it is more impermeable to the acids. So please use a calcium fluoride or a fluoridated toothpaste, so that enough fluorides will help you to make your teeth much more resistant to bacterial attack, and caries will be kept off. Please make sure that you brush twice daily. See, due to corona, we are a little lethargic. Most of the people are in lockdown. Some of the people are not moving out of the house. So they are like morning routines have been changed. They get up late, then they have the breakfast very late. So sometimes you skip your brushing. Sometimes you sleep early, so you skip your night brushing. So please don't skip your brushing. If you skip your brushing, that also will reduce your longevity of your teeth. So please make sure that you brush twice daily. But some people have become really enthusiastic, because they have been watching some of this social media and things like that. They want to make teeth whiter, they want to make gums stronger and things like that. And social media is flooded with so many ideas. See, whatever they can mix. So they make a mixture out of lemon, and sometimes with soda, sometimes with pomegranate, sometimes with a lot of ideas. Because whatever, see, they'll show you a good title saying that, oh, with this one, with one lemon and one little bit of salt, we can change your teeth into white. And people are very interested, and they do all this all the mixes and try it at home. Please don't try things at home at this time, at least, because corona times, you cannot get, most of the people cannot get a dental appointment. Dentist doesn't give most of this, especially some sensitivity and all. They'll tell just to you use some sensitivity paste and things like that. They delay the dental appointment. Most of the dentists are not having their dental practice even during this time. Some people have equipped, and we have equipped ourselves, and we are taking patients, but it is, in some cases, it is very difficult. And most of the people, even with all this suffering, they are not willing to go out of the thing. So please don't try out stunts which is given by YouTube. They are giving it for their own benefit. It's not for your benefit they are making the videos. So please make sure that you don't do stunts at home. Don't do all your special exercises, which is like backflips and things like that. You might break your teeth and things like that. Please don't do all those things. It's not time for that, because you can do it, but protectively. Do it with protective gear and things like that. Don't do it at home without anybody looking at you and having some help and things like that. See, emergency care also needs COVID testing and things like that. It is very difficult to get all those things. So please avoid all those things, and also make sure that you don't use sensitive paste. See, most of the people have sensitivity after trying out all these things. They use a sensitive paste regularly. Then what happens is, sensitivity paste mostly will give you trouble. The caries will not be noticed if you don't have any sensitivity. The caries will become root canal treatment, and then you'll have to go to a doctor for a costlier appointment, or specialist appointment is required to correct your teeth at that point of time. So please make sure that you don't do stunts. Please make sure that you do correct your problems and things like that, and get an appointment with your dentist. It is no problem going to a dentist, But even if you don't get, there is another way to do a teledentistry. My next video is about teledentistry. Please make sure that you watch it. How we can actually contact your dentist and then talk to the dentist efficiently and effectively without taking much of his time, nor your time, so that you will get an idea what can be done during these corona times. You can actually consult online now. Most of the dentists, they have their online consultation done through all this media which is available, even through some of these efficient videos like FaceTime or WhatsApp or whatever. So please make sure that you have a very good dentist and get it done. To know more about it, please watch my next video on teledentistry. What can we do during this corona times? Thank you very much for watching. Please subscribe my channel and refer it to most of the people, because it's corona times and we need to have our dental health also looked after. Your health is very important, even your dental health and smiles. So make sure that you smile. Corona times will go, because we have endured most of these pandemics even before. So it's not for long, but we have to go ahead. So all the best. Let's combat the corona, and also we'll have a great health and great smiles. Thank you very much.
Wikidonist.com. Truth about tooth.